Hello everyone, I am Iva Patel working with UN Mehta Institute of Cardiology and Research Center as research assistant. Today here I am going to talk about relative risk and absolute risk. What is relative risk? Relative risk is the ratio of probability of an outcome in exposed group to the probability of an outcome in unexposed group. It shows the relationship between exposure and outcome. Relative risk is used in ecological data, cohort study, random clinical trial, adverse drug reaction, and intervention studies. It requires two binary variables. One is event occurred or not, and another is exposure group, exposed and unexposed group. How to interpret the relative risk? Relative risk greater than 1 indicates the increased risk in the exposure group in comparison to the unexposed group. Relative risk less than 1 indicates the exposure have less risk than the unexposed group. And relative risk is equal to 1 means both have same risk. How to calculate the relative risk? Here I have shown one table. Here predictor and outcome variable. Relative risk is equal to A upon A plus B upon C plus D. Let's take one example over here. Incidence in exposed group upon incidence in unexposed group. Uh, that is, I have taken an example of lung disease present and absent in the event group, and in the exposure group, smoker and non-smoker. So the incidence in the exposed group, that is 800 divided by 1000, so it is zero point 0.8, and incidence in unexposed group, that is 40 divided by 2000, that is 0.02. Converting this decimal into the percentage, 80 by 2, that means 40%. It means that in the exposure group, there is a 40% risk of having a lung disease in comparison to the unexposed group. Uh, RR can, relative risk can become extremely large when the chances of an event in the unexposed group is low. Here I have taken one example that it is published by Vogel Chang et al. In 2050. His aim was to quantify the mortality risk of infection in dialysis and kidney transplant patients. In his result, he found 82-fold higher with infection related mortality in dialysis and kidney transplant patient in comparison to the general population, means unexposed group. And in his study, he found that women aged between 20 to 29 years, the mortality rate ratio was high as 565, meaning that the women in that age category who were treated with dialysis had a 565 times higher risk of dying from infection than women of same age in the general unexposed group. The number is tremendously high. That is due to the occurrence of the death from the infection, that is very low in the general population, that is 0.01 per thousand patient per year in general population. Most of the time we use the relative risk in the meta-analysis study. There is one drawback, that they do not give a true reflection of how much benefit the individual would derive from the intervention, as they cannot discriminate between small and large treatment effect. They usually tend to overestimate the benefit of intervention, and for that reason most of the drug company uses relative risk. This drawback can overcome by the absolute risk is that reflects the baseline risk better and that discriminate between small and large treatment groups. Now going to the absolute risk. Okay, what is absolute risk? Risk can be expressed in absolute terms by the absolute risk difference. It's also called attributable risk. Absolute risk is the number of people experiencing an event in relation to that population at risk. It is also individual risk of some event happening in that particular group. How to calculate absolute risk? That is absolute risk in the exposed group, that is positive event in the exposed group upon total number of cases in the exposed group, and absolute risk in unexposed group, that is same positive event in the unexposed group divided by total number of cases in the unexposed group. Formula to calculate absolute risk difference. Most of the time we shows the absolute risk difference attributable risk. That is subtracting the incidence risk among an unexposed group from the incidence risk among exposed group. That is A upon A plus B minus C upon C plus D. I have taken one example that shows you the difference between the relative risk and the absolute risk. In figure 1 and in figure 2, next slide, in both the figure there are 60 and 60 subjects are present in both the group. The black shows the outcome of interest, and white shows the cases didn't have any outcome of interest. Here in the figure 1 there is a lesser number of outcome in comparison to the figure 2. Here the relative risk is 1.67, means 67% relative risk over here, and the cases are outcome is very low, and absolute risk over here is 2%, and it is showing a lesser outcome and the lesser absolute risk over here. In the figure 2 there is a outcome is higher, outcome of interest is higher in comparison to the group figure 1. Here the relative risk is same as in figure 1, and the absolute risk is 24%. So here, as the outcome increases, the absolute risk increases, and the relative risk is same in both figure 1 and figure 2. So the relative risk sometimes gives us an incomplete data, incomplete result in comparison to the absolute risk that gives us precise result. And that's why most of the drug company uses and shows us relative risk, that so and so drug reduces the incidence by 50-60%. But if we count the absolute risk, if we analyze the absolute risk, then it shows the precise data. Thank you.